and welcome to today's special episode, which is the fourth episode in our June menopause series. And I have a lovely guest joining me today who's a local friend, Anna Slater. She is an NHS palliative care nurse and she also runs her own aesthetics clinic and has recently been doing some training on menopause and female reproductive health. So we're here to chat all things menopause and get your expertise, Anna. So welcome to the podcast.
Hi, thanks for having me.
Yeah, great. Thanks for making the time to record. So I know we've got lots that we want to share about, and I thought we could start with just getting really plain and simple about what menopause is, because I've been sharing other people's real stories of perimenopause and menopause the past 3 episodes, and I've had loads of feedback, which is brilliant, but it's amazing how many women still struggle with exactly what menopause is. So yeah, with your nurse hat on, tell us a little bit about, what's really going on physically and what exactly it is.
And I understand why the struggle to understand how it is and what happens, because I think until a couple of years ago, when I started to sink my teeth into it, I wasn't aware. And I think it's just more spoken about now. But when women experience menopause, people often think, oh well, it's when I haven't had a period for more than 12 months, which yes it is, and the average age is around 51. I think what they don't realise is you can be in a perimenopausal way before that, some years before that. But a natural menopause would be when your ovaries become unable to produce hormones, estrogen, progesterone. But menopause can also happen through your ovaries being damaged by treatment, such as chemotherapy, radiotherapy, or when you've had a surgical menopause, such as a hysterectomy. Yeah, and you then put into a menopause sooner, which happens to a lot of people. So I think that is what happens. And if somebody's age 40 or younger, they're classed as being in an early menopause. 41 to 45, still quite soon, but a lot of people are coming forward now, late 30s and below the age of 45, who are having these perimenopausal symptoms for some time.
Yeah, and I think, certainly for me, all I was really taught, like lots of other women, was just that it's when your periods stop, and that's all you really know, isn't it? And then I know through my journey with, trying to get pregnant, I learned a bit more about your menstruation cycle or your menstrual cycle and what's going on with your hormones and how your eggs rapidly decreasing, especially in your young childhood years. Actually, before you even get to puberty, you've lost so many of your eggs, haven't you? And so then it's that constant.
The average people, the average people will see how it happens in your mid-30s, but things start to change before that. And I just do think it's down to education. I just don't think people realise, and I think that your ovaries just naturally start to fail to produce those hormones and have fewer remaining eggs, and then we start to get symptoms and from that. But I think it's all down to education, and it is getting there. I feel like things are a lot more spoken about. I don't know how you feel. I think there's a long way to go, but I definitely feel like there's a lot more talks about it now, and women speaking more about it now. Certainly for me, with me, it was more, I'm a nurse still, and I've had my own business for almost 8 years, and I've been on a journey with a lot of women. The average age of my patient in my own business is probably 50, and I've been on a journey with them for some years now, and know a lot about them, and know a lot about their families, and know about their jobs, and I've seen the change that's happened to them. And I think I felt like, from my perspective, I was looking after them and making them feel like they felt better because of the treatments they were having. But actually it was more than skin. And I felt that the turning point for me a few years ago was that I'm actually not looking after them from a 360 point of view. I'm not looking after them holistically, because I need to understand what's going inside to make them feel better on the inside and the outside. And I just had a lot of these ladies coming in who were, having a lot of breakdowns and marriage breakdowns and feeling really, really down. And, estrogen, one of the, well, there's estrogen receptors in every layer of your skin. So they were saying, I feel like this, I feel terrible, my skin's dry, I've suddenly got eczema, I've got rosacea, getting embarrassed about it. And initially I thought I've got to learn more about the effects of menopause and perimenopause on the aging factors and the skin and the hair, which then it just led on to other things, because I thought, well, I should be able to look after these people. I'm a nurse prescriber. I should be able to take this a little bit further and look after these people more and offer them advice and refer them on if I can't offer them advice, and just help them along the way. And I think it's getting there. But
and I think, like, a lot of women, worry about aging, don't we? It's the culture that we're part of. We want to look good, and more and more women, even at younger age, are seeking different types of aesthetic type treatments. And I know you do lots of very natural type of treatments, but as you say, women are doing those to try and fight that aging process, but at the same time, like, hand in hand with that, they aren't doing other things that they could to improve and protect the health, are they? And that's down to a lack of knowledge, as we're talking about, with menopause and that belief we've been brought up with, that you just have to put up with it. You've just got to accept what's going to happen, know that you might change in lots of ways, and then it's kind of like an uphill battle to do what you can in other ways to just try and, balance out and try to look good, but not necessarily feeling good inside. So, yeah, I totally get, and you and I have obviously spoke about this a few times, why you're doing this, to try and help women have that 360 approach. So now that you are registered, that you are able to prescribe HRT and you are able to advise and help women, and, like you say, refer them if it's a challenge that needs further intervention and support.
Yeah, absolutely. You have to work within your limits, and that are really complex. There's patients that are complex, and you have to work within your limit. But it has been helpful just to guide them through it. And you're absolutely right with the other factors and the lifestyle factors. And I'll not interrupt you too much, which you were going to mention. It is sometimes a bit of a vicious cycle, because these ladies are coming in and they're feeling so fatigued and low in energy, and they're not sleeping, and their bones are aching. And I'm a firm believer of trying not to fix everything at once, because then you're just overwhelmed with information and you're overwhelmed with trying to do everything at once. And I understand if their eating's not great, and they're maybe drinking alcohol because they can't sleep, so they're drinking alcohol to help them sleep. It becomes a vicious cycle. But sometimes balancing hormones gives them that energy, helps their bones to stop aching, because of the reduced estrogen, the fluctuating hormones, and it gives them that energy that they need to be in the headspace and the sleep to be able to exercise that they didn't have before. So sometimes the last thing they want to do is to go and, not even exercise, just walk, just move, be active. Sometimes the last thing they want to do is to go and think about going for a run or being in a class or going to yoga, because they're unable to do it.
Yeah, I think especially if you're someone who hasn't already had those habits in your life, which obviously I'm trying to help women be as proactive as they can, as early as they can in their life, whether they're at the perimenopause stage or not, because as things do change, it becomes harder when you don't have a lifestyle like that, with self-care a big part of it. And then you start to change and not feel like you. And as you say, there's so many symptoms, isn't there, with those muscle joint pains, skin problems, irrational thinking. There's lots that people don't know are very common in perimenopause, which can turn your world upside down. So as you say, then you don't want to start thinking about eating healthy to stop the weight gain, or exercising, or managing your stress, because you're just caught in that vicious downward spiral. So, I'm totally for HRT. I'll be really open about that. As the program's launched this week when the podcast comes out, a part of the second module includes a bit on HRT, because I want women to be informed about that as well, because perhaps this is something you can help kind of break down, because there's been so many bad raps about HRT. You know, for over 20 years, the NHS has tried not to prescribe it because of the misinformation around the high risks associated with HRT and breast cancer. So I know myself, even a couple of years ago, I was like, there's no way I'm ever taking HRT. Now that I'm educated on it, I know completely the opposite of that, and the findings have been pretty much like squashed, haven't they? So, like, yeah, tell us a bit then about HRT, like how it works and why now it is being, you know, seen as something that's not just safe and supportive for your menopause symptoms, but actually for your future health as well.
Yeah, and I think it is what you. I agree when you say I'm for HRT. I agree that turn back even just a couple of years, maybe would have been a bit uncertain about it. It wasn't something I thought about until I become educated about it and how it can protect our future health. So, you know, women are high risk of cardiovascular disease, especially going through the menopause. And having HRT sooner rather than later when you're going through menopause or perimenopause, it can protect you. It can protect your future bone health, your heart. And I don't think people realise that. I think that some of the studies that were previously undertaken, a lot of people stopped HRT overnight because of those studies, and a lot of women were, you know, unwell because of it, or I guess suffering those side effects again. And a lot of women have been treated for depression in the past, when actually a lot of the symptoms were just that hormones, you know, were starting to deplete and the hormones weren't balanced. So, I guess it's a discussion that you have with your nurse or your doctor. But what I would say to women is, if they think they're having symptoms of menopause or perimenopause, and there are so many symptoms, and I know you're a big fan of using the balance, and you're a big fan of using health, and I mean, you just have to look to see how many symptoms there is. Some of them we probably don't even know of, because they are estrogen receptors in your body, and you know that can cause all these symptoms: the hot flushes, the aching bones, dry eyes. I think just if women are more educated, they would go to the GPs who maybe just genuinely aren't as educated, because like we see when we do our nurse training or GP training, there's no specific training in women's health unless you are a specialist in that area. And menopause, and I know there's a big drive to change that, but just to go with some facts and some evidence and some research, and have a look at the NICE guidelines, go ready to answer questions, because some of those healthcare professionals that you see may not be educated, just as I wasn't a few years ago, about menopause and the symptoms, and HRT, which, you know, a lot of HRT now is very safe. It's body identical, similar structure to what your body makes. So you have a lot of patches so that you reduce the risk of clot. You can try them for 3 months. You can see how you go with them. Doses can be changed. It's not a one size fits all. And I think everybody's menopausal transition is unique to themselves. Some women do see, I went through it absolutely fine, and other women don't. And you know, one woman might need a smaller amount of estrogen than another woman, and I guess as long as you're outweighing risks with benefit, I'm a firm believer about living well.
Yeah.
And I don't think personally that I could cope with some of the symptoms that I see women cope with, because they've maybe not educated about a hormone replacement therapy.
Yeah, and what's saddened me as I've been chatting to people over the past few weeks, and you know, they've seen the podcast, or I've met them at a networking meeting and told them what I'm doing, and they're interested. I'm just hearing from so many women who are already in their maybe early mid-50s, who have either, you know, missed the period for 12 months, so are now classed as postmenopausal, or they're coming up to being menopausal, you know, still at the back end of perimenopause, and they've just suffered in pretty much silence, as in they haven't asked for help because they don't think HRT is safe. They don't really know what the options are. You know, people don't know that now there are different ways of using HRT, like the gel and the patches, and you can get progesterone different, depends if you've had a hysterectomy with your womb removed and different things, isn't there? So there's so many different ways and routes, and it's just about educating people as much as possible. But something I wanted to touch on kind of like the other side of the fence with this is the whole Davina, what do we call it, like momentum, interest that came about on the back of her documentary, which I know Louise Newson, who you've done training with and are a big fan of, she talks about how a lot of doctors have got really like peed off about the Davina effect, they call it, that they think women have watched that programme and then any symptom they get, they're just going to their GP going, I want HRT because I want to look like Davina. And obviously not all of them are sitting there saying they want to look like her, but it's coming across like, well, look at her and her life and vitality, I want to feel like that. And so I think it's a balance, isn't it, that yes, HRT is incredible, and I think personally, my own opinion from what I'm hearing and from many different scientists and doctors, is I think we might get to a point where it's encouraged that if women can take it safely, they do take it, because of what it's going to prevent in their future with the different brain, heart, bone diseases and illness we know about. So I think that might come at some point.
I've heard a lot of that being chatted about at different conferences, and I think some people would say that it was safer to take that than a statin to help with heart disease, to help prevent heart disease. And the statins are probably much more regularly prescribed, but I think they just need more evidence, and that's what it's about, isn't it? Having more studies and more evidence. And it is ultimately about people's choice. Not everybody should be queuing up and saying, I want HRT when they don't need it, if they don't need it, and they're not perimenopausal. But I guess if people are having symptoms, they should be allowed to have what they would be treated for if they had something else that was causing them to have symptoms. If you had another health care concern, you would seek help and have it treated. And these people, they are suffering, and so many younger people as well. I've noticed that maybe has always been that way. It's more spoken about now. So I'm finding that more people are coming forward and talking about it, and the ladies, certainly the ladies that are my patients and the people that I look after, I've always got to know them on a personal level. It's never been a one in, one out clinic for me. I want to get to know people and have a really nice chat with them when I see them. And I certainly think that they are trying to break the taboo and talk about menopause and perimenopause, and they are wanting their choice. They're wanting to be heard. Some of them are very unsure and uncertain about it, and they need to speak to experts, and you need to refer them to some of the studies and to tell them to look at the guidance and make an informed decision for themselves. And some people, who may be high risk, then you would certainly be seeking advice. But it is just about people having a choice and having a discussion and weighing up the risks and benefits. And I certainly think that for a lot of people, they are worried about their future, of women being at more risk of having, osteoporosis and fractures. They want to try and prevent that, and especially if there's a strong family history there of that, then they want to try and prevent that. So it is something that I think they should be sitting with the GP or the healthcare professional with and talking. But my advice would be to go with some education and write things down, so that you go and you know your own body and you know what you're talking about, and it helps the professional to understand as well, who might not have been educated in this area.
Yeah, and that's definitely come through from the other ladies I've spoken to on the podcast in their own journeys, as being, the biggest bit of advice is to track your symptoms use something like the Free Balance app, which I'll link to in the notes, and I have done in the other episodes. If you don't know what that is, drop me a message, on any social media, ask about it, or check the link out in the notes. But it's a really simple way to track. Maybe you just want a little notebook that you have at the side of your bed if you prefer to do it that way. But everyone's given that advice about you being armed with information about you and knowing your body, and you going in control. I know Nikki, who I spoke on the podcast, she was like, I put my lipstick on, I put my power suit on, because she'd, been rejected that many times by a doctor and given antidepressants. And then she was like, this is it, I'm going in control, telling them what I want this time. And, that worked for her. But that story came through from everyone. But I think kind of my point is around the balance with the knowledge and understanding of what HRT does, is that, the Davina program was a big starting block to begin to get more information out there and awareness. And now we've got lots of celebrities talking about menopause, and then HRT. But it's helping women to know that HRT has its role. It's got so many benefits, and it might be right for you, but it's not reversing menopause. It's not going to fix everything. No. And I know I've heard this from certain people I know, who are on HRT and saying, but I haven't lost the weight, or I still have this little symptom, or I still feel like this. And it's like, okay, it's going to help to balance your hormones, but your hormones are still changed. You are still carrying less hormones than you did when you were 30 and 20. And, you still need to do other things in your lifestyle to protect your health, like your muscles, your skin, your joints, your bones, your gut, your brain. There's so many things that I want women to know do change and put us at a higher risk because of menopause. Less of a risk when you do decide to take HRT. But you do still need to protect your health, don't you, to age well and to stay strong?
Yeah, and I think you're definitely right. And, I speak to a lot of women who HRTs absolutely work wonders for, and some of them will say, I noticed a difference more or less immediately. I speak to others who give it 3 months and then said they went back to the GP and maybe it's increased the patch a little bit because they're still having some, vasomotor symptoms or other symptoms that meant they may need a little bit more. So they've increased the patch and they've still not seen a difference. And it has been a real challenge to try and get it right for them. And some of them will say, I'm much better, but I still wish I could be that little bit better. A lady I had in last week said that she broke down to her GP and said, you've absolutely changed my life, because she's changed it so much for the better, and she'd lost stone because she had all this energy. So she was just not just power walking, just moving. But I do speak to ladies who might link what they think is perimenopause and menopausal symptoms to migraine, which it may be, because estrogen can cause a migraine high or low. But also then you dig further and you realise that they eat a lot of chocolate, they drink a lot of alcohol, caffeine. So it isn't always, it's not always HRT that they need. It is sometimes other small changes as well. But some of the bigger changes they can't do without having the hormones back or balanced.
Yeah, definitely. And it's about a combination approach, and it's also about being proactive, isn't it? Because the healthier you are, the more you can minimise the impact of those hormones reducing. So, there's so many, different facts about what exercise can help you to do, what a diet, if you are already overweight, then you're possibly carrying more estrogen and suffering more with that when it starts to fluctuate. So there's lots of reasons why you should protect your health as early as you can, to also be able to power through perimenopause and menopause with, maybe just some quite minor symptoms. Most of my symptoms are very manageable. The moods have been the biggest ones, but I've intentionally changed some things over the past 2 months, and I've literally had nothing on my cycle, whereas for about 5-6 months it was like I'd been hit by a truck for maybe 2 days at the most, and then I would come out of it and think, God, why was I like that? What happened? But I was uncontrollable. emotionally, you know, just the thoughts and way that I felt. Most of the other symptoms at the moment are pretty manageable, but I know that I'm trying to make choices. And also for me, a big thing is around sugar, which that's a
Yeah.
huge part of the program, you know, is about
Yeah. The
what
same
sugar
here.
and that does to you through, or the change in your hormones means to you with food and how you process not just sugar, but all of the food you put in with through, you know, your insulin and your cortisol and the effects that has on those blood sugar spikes. And that's one of the biggest problems that you can't necessarily fix with HRT. You know, like it's going to help you to be
Yeah,
more balanced.
absolutely.
But everyone, even men as they age, are changing in their hormonal structure and the way their bodies work. You know, we're all losing muscle, losing bone density, losing our collagen, losing, you know, or our insulin resistance isn't the way that it used to be, and we become less resistant.
And I mean, that's a whole lot of podcasts in itself, isn't it? The insulin resistance. Yeah, I could
Yeah,
learn a
I
lot
have done
from
one
that.
before with someone on the blood sugar roller coaster, but it's one, you know, that it's important people know the different things that are changing. And it's not just about the mood swings, the
No,
night
no.
sweats, the hot flushes, you know, maybe feeling a bit down, or the weight gain. There's so many things that you can experience, as you said. Who knows? And I
Yeah.
know, you know, I've heard Louise Newson say many times about the estrogen receptors in every cell of your body. So,
hmm
you know, you could. I didn't know that tinnitus was one of the symptoms. I was referred
Okay.
last year to a consultant for
hmm
sudden tinnitus, like really extreme.
Yeah.
I had
I
no
have
idea until I started doing this.
I've had a few ladies the same, and I've had a few who've said, "Oh, I've been diagnosed with dry eye," and I'm like, "All right, okay. Do you think that might be linked to menopause or perimenopause?" And it's not until you chat to them about it that they just thought they had dry eye because it was dry. But there literally is receptors everywhere, and it's amazing how many side effects and symptoms there are. And it's sad as well that a lot of women who are meet and see, not just at work, just daily, the confidence is gone, and these strong, powerful women who have amazing jobs, and they feel like they get a bit paranoid at work, and they feel like they're not being spoken about, but maybe it's not performing the best whereas they did before, and that's another big symptom that a lot of women that I've met will say that they have, that they just don't feel there's no zest for life anymore. They don't get excited anymore. And another thing is, I don't know whether it's where we live, the area where we live is just so different in terms of some people will come in and say, I've had a great experience when I went to see my GP and I got this HRT and I've been back and I'm going to try some, testosterone, and others just can't get anywhere with their GPs. And I do think it's down to just education and confidence um, about the menopause and perimenopause, and maybe the worry of those studies and people being at risk. Um, but they're so different. Some people are getting, treatment that they want pretty much straight away, and other people are really having to fight it still, or
Yeah,
go
it's definitely a postcode lottery,
for
isn't
it.
it? There's a couple of people I spoke to who didn't come on the podcast, but I chatted to, and one of them, she'd had some treatment for precancerous cells many years ago, and she was still under a consultant in Harley Street, and she went, and anyway, she shared this experience that she'd had versus going to our local doctors and where our friends had gone. And, on Harley Street, she said they're just literally dishing them out like Smarties because you're paying for it, and there's a lot of celebs going, but then you go back, half an hour to where you live and you can't get them for love nor money, even when you're literally on your knees. And I think it was just interesting what you said about the confidence and how people feel at work. And again, I've heard that, and I've done lots of research on that, because one of the workshops I'm just delivering actually this week is on menopause in the workplace. And they say 1 in 10 women actually leave their jobs because of menopause, but there's a huge number who consider leaving because of that. And there's also a massive proportion who don't have the self-belief to go for promotions, to change their job. And that's something I really want to, bring across to people and say why it's so important that we take care of ourselves and we do make sure we still feel strong. And as you said, have that zest for life, which I love that saying. I've used that in the sales page actually for the program, because when we've got that zest for life as women, we can make change happen, and all the equality, the equity we want in the world. I know it sounds big, but women make that happen. Like, look at history. Women are the ones that make these great big changes in history come about. Like, we need to be showing up on the boardroom table. We need to be running our own business. We need to be inspiring our daughters, because that's how we're going to change. And if we think that we're not good enough when we get a bit of brain fog and lose our memory, and then start telling ourselves that we've probably got early dementia and we're no longer capable of doing a job like that. And so we drop part-time and then we just like curl up into ourselves. That's not going to happen, isn't? So you've got to take care of yourself so you can be that strong woman, because reality is that pensionable age has increased massively. We're going to be working for a long time post-menopause, whereas even in the 60s, women might work 5 years after menopause if they were working at all. Yeah. Whereas, we've come such a long way in such a short space of time, where now, as you say, that the menopausal age does seem to be reducing down. Maybe that's because of our lifestyle. I'm sure over the years we'll find more out in the research about the impact of our diet and way of life on the changes happening much earlier. But then we've possibly got to work for another, like in some people's cases, 30 years after going through it. So we can't afford not to be strong and capable still.
No. And it is a total aging population, and it's, I work in an acute hospital and I see it. We do look after lots of women, in the 90s a lot of the time, and men. So, you've got people are living longer, and you should live well. Yeah. As well as you can. And what
that's
I
what it's all
people
about,
realise as well. Yeah. And I think given there's always going to be more education and more studies, and that's really helpful for us and for our patients, because I think a lot of people don't realise either that they automatically link HRT to, I don't know about that. I know somebody who had that, and they were taken off it because of a family member who had a certain cancer. A lot of people do worry about it. We never really seem to talk about the other risks of cancer, such as alcohol intake.
Alcohol's one of the biggest risks.
Disease.
Yeah. Exactly, like smoking.
Smoking can put you through menopause earlier. There's lots of other things that I feel like we don't speak about enough. There still is that. A lot of people I see are coming so far that they're educating themselves. Women are educating themselves because they want to feel as good as they can for as long as they can, because they're young. This is another chapter that we're going through in our life, and we should just enjoy it. And they're young and they want to enjoy themselves and be their old self. So they're starting to educate themselves when it comes to HRT. But there is a lot that don't understand some of the other lifestyle factors that are causing risk. And some of them, as soon as you mention HRT, they're very put off by it. And a lot of women who will say, "Oh, I can't have that because somebody in the family who had cancer," but that family member might not be a first degree relative, and it's not that straightforwardly can't have it. It should be a chat between yourself and the healthcare professional who's looking after you and about those risks and benefits.
Yeah, and so I would say, if anyone's listening, obviously Anna's the one who can talk more on this, but if you have had a cancer and think that means you can't have HRT, to speak to your consultant, to speak to someone specialised in this, because the findings now are that in most cases, even with many, many breast cancers, you are able to have HRT of some type. But again, as you've touched on a few times, it's your decision. It's an informed decision that you make together with the person who's qualified to treat you, and you make it based on that, your decision about what you're experiencing with menopause versus whether there is any increased risk. But that risk that was found over 20 years ago with HRT and breast cancer isn't the risk, is it? That was very different type of HRT. It was the tablet form made in a different way to how it is now. And even then it wasn't quite the way that the results had portrayed it to be. It was a big screw up on many people's behalf, wasn't it? That have now, it's now been like overturned. So it's just about knowing the facts, but not just assuming. Because I have heard women, again, I've spoke to, said, oh, I've had breast cancer, so I can't have it. And then when I've started chatting to them, the type of breast cancer they've had and maybe the treatment means that they're just like me. There's somebody who actually could choose to have it if they want it without any great risk because of that. So yeah, definitely.
You're absolutely right. If it was a lady asking me for that advice, I would absolutely be, speaking to somebody with a bigger level of experience and making sure that they spoke to oncologists about that, but not just, dismissing them and straightforwardly saying you'll never be able to have any treatment because of your past medical history. Just speaking to other professionals about it and referring them on and getting some advice.
Yeah,
because it's not only cancer. It's people who may have somebody in the family who've had cardiovascular disease or who've had a clot. Who you get people who think they can't have HRT because of a lot of disease in the family, and I think it's just that education.
Yeah,
Of
definitely.
how it's delivered and the different ways that it can be delivered, which means they're safer.
So just to kind of wrap up with, the most of the women you see, I know there'll be lots of different things you hear as you've touched on, but is there a common thread that you see, like that women are being impacted by the most with perimenopause and menopause?
And do you mean a symptom or?
Yeah, like, or a symptom that's maybe, I know you touched on lack of confidence and that self-belief. Like, what do you think is the biggest problem? Is it the physical failings of some of the symptoms, or is it then what it does to who they are in their life?
Both, but I think for me, over the past year, and certainly taking more notice of it, I definitely think there's been so many tears in my clinic, and I think probably psychological impact and confidence. Don't get me wrong, there is a lot of physical symptoms, and you could talk a full hour about one symptom, couldn't you?
Yeah.
And I have lots of women chatting about all sorts of symptoms all the time, and some of them are new to me, and I think I'll better look that up. I wonder if that's another symptom. But I certainly think for me over the past year, listening to the stories of relationships breaking down and how women have felt, and the psychological impact and the lack of confidence and the mental health for me has been a big eye opener. So I would say, yeah, and the one that I would really want to help with, yeah.
Definitely. And I do think that you can support yourself with that by being as healthy as you can, to protect your health mentally and physically as you approach that season of your life. And none of us know whether we're going to be the person that has, really big swing in our hormones. That means it's just something, which we're kind of unable to fight against. But yeah, the psychological and mental health part, again, that's been a thread through everyone I've spoken to. And I think that's why we see, such a high percentage of people who go with these kinds of symptoms at this stage of their life get offered antidepressants and told they're depressed, or then get, shunted onto higher types of antidepressants and because they're not working, because it's not a problem that antidepressants can fix because it's hormonal, that it's been misdiagnosed. But as you say, we're on a turning point really with that changing, so that medical staff are getting trained better, are upskilling in their knowledge around this to help people more. And so that's a great call out, for people to be aware of as well, because people I've spoken to find it confusing, you know, when the doctor tells them they're depressed, and they're like, well, am I depressed? Like, yeah, I feel like I'm down at times, but I don't think I'm really depressed. And that's a big difference. It's something I touch on in the programme with mental health, is around trying to know, is this because of real mental health type issues, or is it triggered by hormones that are causing my mental health to not be as strong? Because it is hard. Women are living busy lives, aren't they? Stressful lives. You know, many of us are juggling careers. Our family were the main caregivers, and lots of responsibility on our shoulders, which again has been referenced as potentially the reason why we're experiencing much more symptoms much earlier, because, you know, our lives are a lot busier and full than what they were 50 years ago in different ways. So
and they always are going to be those patients who will need an antidepressant and will need referring on. I guess the amount of women that are coming through that are saying they were treated with antidepressants, and nobody looked at the guidelines, and actually they knew deep down that it wasn't depression, was quite surprising.
Yeah. Oh, well, it's been lovely chatting. You've given us lots of great information, lots, I'm sure, for people to think about, and hopefully, you know, be feeling like they've got more knowledge now about HRT in particular, but just the whole menopause journey and what you are able to do when you take control and put the power back into your hands, that, as we said, you can have the zest that you want in your life for as long as possible, because we all want to be the ones boarding the plane to Benidorm or wherever, you know, when we're 75 with our mates, don't we? We don't want to be sitting at home just stuck in the chair, barely able to get up and use the bathroom on your own.
I see those little adverts pop up on Instagram, and I think that's definitely me and my friends.
Yeah.
I hope so.
Yeah, me too. Definitely. I might not be Benidorm at that age, but I'm thinking maybe more of a retreat in Mauritius or somewhere. Wishful
nice.
thinking, eh? Oh, well, thank you so much again, Anna. It's been lovely chatting. For anyone who wants to reach out with Anna, I'll pop everything into the show notes. But just, to let everyone know where they can find you on Instagram's the main place that you all show up and have your business details, isn't it?
Yeah, you're able to add that in.
Yeah, I am. Yeah, so Anna Aesthetics on Instagram, you can find out more. And I know you've got your new website about to launch. You'll have all of the info on there about how you could connect with Anna if you want to find out more with Anna on menopause and HRT and the services that she offers. So that's all coming very soon, isn't it?
Yeah.
Yeah, brilliant. All right, thank you.
Thank you.